Good morning, English 2. I hope you're all doing well. Today we're going to tackle together our first unit in the book, which is about accident and emergency. I think it will be very interesting to write an argumentative essay on this topic. So by the end of this lecture, I'm going to tackle with you our first assignment, but for now, let's try to find out the difficult vocabulary, the most important points, and at the end, I'm going to tell you about the midterm exam and about writing an argumentative essay. طبعا أنا أتمنى كنتوا انتوا ذاكرتوا اللي احنا اتكلمنا عليه المرة اللي فاتت وفهمتوا عن argumentative essay. If you have any question or any inquiry, يعني ask me anytime, okay? Okay, let's start. Every day, through the doors of E&E departments, come the victims of road traffic, accidents, violent crimes, accidents at home, suicide attempts, self-harming, contact with toxic chemicals and radiation, burns, near drowning, hypothermia. كل دي أعراض طبعا لما بتحصل أي حد أو مشاكل بتحصل أي حد لازم طبعا هو بيبقى على طول بنروح ال E&E department اللي هو الطوارئ في المستشفى. الحالات طبعا بتحتاج رعاية خاصة، لكن بيقولي برضو ال E&E department also fill up with people who shouldn't really be there. people with minor injuries. في طبعا الناس اللي بتصاب بإصابات طفيفة جدا برضو ساعات برضو بتلاقيها تجري على قسم الطوارئ علشان تشوف لها حل، لكن هل فعلا هي تحتاج تروح ال E&E department ولا لا؟ So when is an accident an emergency؟ امتى نقرر ان ده emergency؟ اما الدكتورز بيدوا أولوية priority لأنهي حالة. اوكي، طبعا الكلام ده كله هو introduction لليونت، يعني انا عايزاكم بس تعرفوه عشان يساعدكم في الرايتنج، لكن مش عايزاكم تحفظوه او to memorize it. اوكي، بس احنا بنعرفه علشان لو جالي writing يبقى عندي information about this topic. Okay, it's complete. Generally, A&E department normally consider an emergency to involve one or more of the following. Number 1, loss of consciousness. فقدان الوعي. Heavy blood loss, suspected broken bones, chest pain, يبقى يكون في ألم في الصدر lasting 15 minutes or more, difficulty in breathing, overdose or poisoning. okay, طبعا معروف الكلمات overdose لو حد أخد جرعة دواء مش مظبوطة أو لو في تسمم. There are established procedures for dealing with casualties of major incidents. في الحالات بيكون فيه بقى أكتر من مصاب زي مثلا terrorist attacks, large fires, multiple road traffic accidents. يبقى لازم في technique or policy علشان نقرر who is a priority. Okay, one of the first things is to decide who is a priority and needs to be treated immediately and who can wait. One method is to color code patients like blue are patients who are severely injured and will die. Red, patients who need immediate surgery or other life-saving action. Yellow, patients who are stable but who will need hospital care. Green, patients who will need to see a doctor but not immediately. White, patients who only require first aid and home care. طبعا واضح كده من اللي احنا قلناه ان working in A&E department can be very stressful and it is not uncommon for staff to suffer trauma, nightmares and anxiety as a result of the emergency they deal with. طبعا اكيد الدكتورز اللي هناك ما بيكونوش في حالة طبيعية ودايما بيعانوا من من nightmares او trauma and anxiety. الموضوع ده مهم جدا لان ممكن اطلب منك to write an argumentative essay. Okay, argumentative essay at the end of this lecture about this topic. Okay, so concentrate throughout the lecture about this part. ازاي هما القسم ده بالذات بيحتاج معاملة خاصة، ممكن يحتاج extra money، يحتاج extra training. هل انت توافق على ده؟ for or against، مع ولا ضد؟ يبقى احنا دلوقتي هنتكلم في موضوع argumentative. تمام كده؟ Okay, let's complete بقى and open our book. اوكي طبعا في البوك page 3 and the first part in page 4 كنا محتاجين طبعا to be in the lecture halls to discuss the questions together. So we can skip it now. Skip question number 1. As for question 2, vocabulary is important. Let's try to answer them together. طبعا try to answer them before you got the answers, okay? To check your information. So number 1 is to sterilize a clean sharp needle with alcohol. 2. Make sure there is no glass or other foreign body in the wound. 3. Use the needle to puncture the blister. 4. Don't remove burned clothing. 5. Squeeze the main artery if necessary. 6. Keep the injured person lying down. 7. Immobilize the injured body part. Treat the person for shock. 9. Don't immerse severe large burns in cold water and don't put under a surface of or liquid 10. Check for signs of circulation. 11. Swab with iodine or rubbing alcohol. 12. Apply antibiotic ointment and cover with a bandage. Okay, page 5. We have here instructions at the bottom of the page. طبعا in this lesson the book explains imperative اللي هو ايه to tell somebody what to do. imperative اللي هو الأمر. فهنا طبعا بستخدم اقول ايه check for signs of circulation, apply the pads to his chest, don't remove. طبعا هنا استخدمت don't في حالة اللي أنا ايه بدي negation. To emphasize what is important you can use make sure, like make sure the wound is clean, make sure you don't touch it. When asking for instruction you can use the present simple. لما أجي أقول مثلا what do I do now, do I have to, shall I take this. طب الفكرة هنا في الimperative اللي هو أصل الجملة إيه؟ you apply, you don't remove, you make sure. بس إحنا هنا طبعا على أساس اللي هي مفهومة طبعا أكيد أنا مش هأمر نفسي أو هأمر just you، فبالتالي إحنا بنعملها null وبنشيل السبجكت. نيجي لإكسرسايز page 1 page 6 اللي هو 1 match the beginning and ending of the sentences. فعندي number 1 check that the patient is breathing. Make sure you use a sterile needle. 3. What do I count up to between breaths? 4. Don't let the patient try to stand up. 5. Should I put the burned area under running water? 6. Shall I bandage the wound now? 7. Don't tie the bandage too tight. 8. What dosage shall I give her? 9. Take the patient pulse again. 10. Where do I have to apply the pads? Okay. Page 7, I have the definition. Defibrillator is very important. You may be asked to write or to define defibrillator. Defibrillator is used to make the heart start beating correctly after it has stopped or become irregular. It works by sending an electric shock through paddles or electrodes placed on the patient's chest. Now we are going to answer and tackle together the reading page 7, 8, and 9, and 10 and 11. But before we begin the reading, page 8, I would like you please to read the questions first, page 7, then we are going to, I will read it with you, okay? British taxi driver Clive Lawrence became a midwife for an hour when a passenger gave birth to a baby in the back of his taxi. Aisha's baby was due in a month, but when her contractions started, she called for a taxi to take her to the hospital. Mr. Lawrence answered the call. The expectant mom was in the taxi for 10 minutes when she realized that things were happening too fast. The baby wasn't going to wait. Its head appeared, and Mr. Lawrence stopped the taxi to help with the birth. Mr. Lawrence said, I was there when my kid was born, so this wasn't completely new for me. I spoke to a nurse in a taxi, read you, and she gave me instructions. I only did what she told me. There's nothing special about that. 1 minute I had one passenger, then had two, but there is no extra charge. A midwife at the hospital said giving birth on the way to hospital doesn't happen often, but if you are there when it does, just support the baby's head and guide it out, don't pull. Then clean the baby's nose and mouth, but don't cut the umbilical cord, just lay the baby on the mother's chest, cord and all. Dry the baby with a clean towel or cloth, gently rub its back, then cover mom and baby with a dry blanket to keep them both warm, and wait for medical help to arrive. Clive was wonderful, the mother said later. He did everything right. Aisha's named the baby Muhammad Clive. Mother and baby are both doing well. So the question, page 8. Was this Clive's first experience of birth? Who gave instructions to Clive? Who is Muhammad Clive? How is the baby now? Paramedic is a person who is trained to do medical work, especially in emergency. Reading page 9. I'm Jeff Oliver. I am 24 years old. I decided to become a paramedic when I saw two of them treating a driver at the scene of an accident when I was a boy. I started as a trainee ambulance technician and trained for 2.5 years to become a qualified paramedic. Now I administer life-saving procedures myself as part of my everyday work to defibrillate the heart of the cardiac arrest, to apply splints to limbs and dress wounds, and to set up drips. يا ريت نعرف the meanings of these phrases. I have to make quick decision. It's an important part of giving emergency treatment, so is communicating clearly and keeping a clear head in some difficult situation. And situations are often very difficult, especially when we have to deal with people under the influence of drugs and alcohol. But paramedics don't think twice. We are always first at the scene when there is a suicide, a road accident, or a fire. When you save a life, is the best job in the world. Signs and symptoms, page 10. Paramedics often have to deal with shock, a condition that is often caused by major trauma such as traffic accident. Shock occurs when the heart is unable to supply enough blood to the organs. This results in a slowing down of the vital functions and can cause death. Shock is difficult to diagnose in its early stages, which makes it hard to treat. Read about signs and symptoms of shock and complete them. Number 1, طبعا الchoices عندي هنا blood pressure, cardiovascular, abnormally, dangerously, abdominal, central nervous system, intestine, coma, respiratory, gastrointestinal. طبعا ده هنذاكره كويس جدا الفوكابلري ده. طبعا blood pressure ضغط عالي، cardiovascular ليه علاقة بالقلب والأوعية الدموية، abnormally يعني بطريقة غير طبيعية، dangerously يعني بطريقة خطيرة، abdominal منطقة الستومك، central nervous system معروفة، intestine الأمعاء، coma غيبوبة، respiratory تنفسي، والآخر اللي هو ليه علاقة بالجهاز الهضمي والأمعاء. Number 1 هتكون the central nervous is affected. This can cause changes in personality and restlessness, in advantages, confusion, and ultimately coma can result. Their temperature may be ممكن نستخدمها abnormally أو dangerously low اللي هو hypothermia or high hyperthermia. بعديها cardiovascular problems may develop. The patient's heart often beats abnormally fast, but heavy bleeding may cause it to beat too slowly. An abnormal increase in breathing rate can lead to respiratory distress or failure. آخر حاجة blood pressure can be high in the early stages, but then hypertension is common as it falls abnormally أو dangerously. يعني ممكن دي أو دي نستخدم الadverb ده. Both of them are acceptable. Okay, thank you so much for this lecture. If you have any questions, just contact me. إن شاء الله هنتكلم في lecture جاية على midterm. Don't worry, but study well the unit here. Okay, thank you so much.